Hello, my name is Wendy Wilson, and I'm here with my sister Amber, and we're going to be doing a head-to-toe exam. Amber, I'm just going to let you know that I'll be checking your hair, checking your skin, just doing a head-to-toe exam. We'll check your arms, your legs. I'll have you do some motions, do some walking, just so I can check some other things, and then we'll have you lay down, and I'll do an exam that way as well. Okay. All right. To start with, we'll do the cranial nerves, and so first we'll check cranial nerve 1, which is going to be your nose. We're going to have you smell. So I'm going to have you occlude one side. Okay. Go ahead and occlude one side. And then I just want you to tell me, go ahead and close your eyes. Smell. Tell me what you smell.
Lemon.
Okay. And then go ahead and occlude the other side. And then we'll have you smell. Orange. Okay. And then cranial nerve 2, we would do an eye exam, which we've just already done that. So we're good with that. Cranial nerves 3, 4, and 6 are going to be your eye movements. And so I'm just going to have you look at my finger, and I want you to follow with both eyes. And just keep your head straight. Okay, and then I want you to follow my finger to your nose. Okay, and that's good. And now we're going to do a light exam. We'll do a light exam. So I'm just going to have you look straight at me,
Okay.
and then I'll pass the light over to make sure your eyes are reactive and equal, and then go to the other side, do the same thing, reactive and equal, and then I'm going to shield one eye and then do the light, and just to make sure that they both respond. Light, they respond equally. Light, they respond equally. Okay. So next we're going to do the facial muscles and your feeling. So first I want you to tell me what you feel is sharp or dull. So I'm just going to do this right on your face. Okay. So is that sharp or dull?
Dull.
And do you feel it here?
Okay.
You feel it here.
Mm-hmm.
Is this sharp or dull?
Dull. More sharp, I guess.
Okay. And then the other side as well. What did you feel?
Dull.
Sharp. Okay. All right. So now I'm going to have you raise your eyebrows, and then I want you to smile, frown, and then I want you to puff out your cheeks. Okay, good. And now I'm just going to whisper something at a distance, and I want you to tell me what I've said.
Okay.
So occlude this ear. What did you hear? 3. Okay, and then cover the other ear.
2.
Yes. Okay. So that's cranial nerve 8. Cranial nerve 9, 10, and 12 are going to be your tongue. So I want you to stick your tongue out at me.
Okay.
And then I want you to stick it into your cheek, side to side. Okay, good. And then I want you to stick your tongue out, like
Okay.
And then I'm just going to use the back side of this as a tongue depressor. So I want you to stick your tongue out, say ah, and then I would also touch the back to show the gag reflex.
Okay.
And then while you're opening, I'm just going to check the inside of the mouth just to make sure that all areas look healthy and normal under the tongue, just to make sure that there's no concerning spots and everything looks good. Teeth look good. And next, I will have you drink water.
Okay.
I'm just going to watch your swallowing. So just take one swallow. Wonderful. All right. And then next, I'm going to have you shrug your shoulders. And then I'm going to put my hand to your face, turn that way for me. And then I want you to push against resistance. Good. Do the same. Push against resistance. Good. Okay. So now we've gone through 1 through 12 of the cranial nerves. And now I just want to have you do some quick motions. So stay right there. But I want you to put your hands on your lap, and then I want you to do good. And then we'll do fingers to thumb. Good. Okay. And next, I'm going to put something in your hand. I want you to close your eyes, put out your palms, and then I want you to feel that and tell me what you feel.
With my one hand.
Yes.
Paperclip.
Okay, good. And then on the other side, close your hand still and tell me what I'm drawing on your hand.
A B?
Yes. Okay. All right. So now I'm going to start the head and hair assessment. So then I would just check the hair just to make sure that the texture is fine, that there's no abnormalities there. And then also just check to see if the distribution of hair is normal. And then also feel the scalp to find, to look for any abnormalities, lumps, bumps, and also tell me if you have any pain with what I'm doing. And then from there, I would also just be checking the skin on the face just to make sure that there's no abnormalities, no lumps or bumps. And then next, I'm going to come down to the ear, and then I would be checking the back side of the ear just to make sure there's no lumps or bumps or pain. If you have pain, let me know. And same with the front, and then the external of the ear. We'll check that to make sure there's no pain or discoloration. And then I'm going to examine the inside of the ear by pulling back and taking a look just to make sure that the ear canal is not red, discolored, painful, just to also make sure that the TM is normal and reflective of the light. Next, I'm going to move to your nose, and I'm going to just look up both nares with the speculum. I'm looking to make sure that the color is normal, it's pink, there's no abnormal drainage, swelling, and I would do that for both sides. And then I'm also looking to make sure that the septum is not deviated and your septum looks like it's in the right position. Do you have any problems with breathing through either nostril? No. Okay, good. Okay, so from there we've done the mouth already as well, so the condition of the mouth looks healthy. So now we're going to move to the neck. So I'm just going to palpate your neck and just see if I can feel any abnormalities or swellings. And then I'm also just palpating the lymph system just to make sure that there's no swollen lymphs, no painful lymph nodes, and that would also be down into here as well. And then just front underneath the chin as well. Any pain or swelling, discomforts? Nope. Okay. So now I'm just going to look at the neck, and I'm just making sure that the neck is in symmetry, that there's no deviations. And now I'm also going to check your thyroid. So I just need you to take another swallow of water, and I'm just going to fill your thyroid as you swallow. Okay. And that does not feel abnormal. Okay. And then from there, I'm going to have you, I'm going to do your exam on your back, just to find, I'm going to both be percussing, listening, and touching. So when I place my hand here, I want you to say, just to quietly say 90, or just say 99.
99.
Okay. And then I'm going to feel down your back, just to make that back of your spine, just to make sure there's no pain or tenderness. That feels okay? Mm-hmm. Okay, so now I'm going to listen. I'm going to have you take a deep breath in. Breathe in. Breathe in. Breathe in. And breathe in. And breathe in. Okay, good. Now I also am going to listen while I have you say E, like E. Okay, okay. Go ahead.
E.
And you can just say it a few times if you get a breath.
E.
Okay, good. And now I want you to whisper for me 1, 2, 3. Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, very good. All right, so that all sounds normal. Now I'm going to have you lay down here. And then we're going to move to the front. So I'm going to actually just sit up there just for a minute. I'm going to listen to your heart tone. So we're going to start. We're going to do the aortic, pulmonic, and then down it's below would be herbs, and then tricuspid, and then mitral. And that sounds good. You can go ahead and lay down. So here, I'm going to move to the abdominal exam. And so to begin with, I'm going to pull up your shirt if that's okay, and then I'm just going to examine to make sure that the coloring looks normal, there's no lumps, there's no anything to be concerned of there. And then I'm going to listen first. You can put your hand on top where it's comfortable. So I'm going to listen to all four quadrants. And we're listening for vowel sounds in all four quadrants. Okay. And if I'm not able to hear the vowel sounds, I would listen for a full 5 minutes. Okay. So next I'm going to do percussion. And so I'm just going to tap my middle finger here. That all sounds good. And next I'm going to, let's see, I also need to listen to, actually I'm going to just percuss for the aorta. Okay, I'm not feeling that. And so now I'm going to just do a light palpation. Just let me know if there's any tenderness, any pain. Okay. And so now I'm going to do a deeper palpation. And I'm checking for your liver and also your spleen. So let me know if there's any pain here. And then let me know if there's any pain here. No pain there. Nope. No pain there. Yep. Okay, great. So I'll have you sit up for me. And then I'm going to listen to your lungs at the front as well. So I'm going to have you take a deep breath. Take a deep breath. And then take a deep breath. And take a deep breath. Okay, great. Okay. So now at this point, let me have you come to a standing. There. And so I'm going to move that real quick for you. So what I'm going to have you do now is I want you just you're doing a great job of standing right where I need you to be. Perfect. So we're going to stand there just to check for balance. And then what I want you to do is close your eyes. I'm just going to make sure that you're not going to sway and you're managing balance that way. Okay, so now, Lucy, you need to get out of the way, sweetheart. I'm going to have you then put your arms out, and I want you to bring one leg up, just balance for me, and now do the other leg up and balance. Awesome. And then you can put those back down. And then I just want you to walk, so come and start over here, and I want you to walk on your heels and then go to your tippy toes. Okay? Good. And then turn back around, and I want you to walk heel to toe. And we're just checking for getting the name scoliosis. Good, thank you. And then I'll just have you come back over here, and then I'll have you sit back down in the chair. Okay. So now what we're going to do is check. Just use the bathroom stethoscope. We're going to check for reflexes, and so I'm going to take your arm here, and we're going to do the tricep. The bicep, knock here, and then it would flex, which would be normal, and then I'm going to knock here, and then it would flex for the bicep, tricep, and then I would knock here at the radial, and your hands would flex if I actually had a hammer. Do the same thing on the other side, and then put your legs out like that, and then I would tap here, and then there would be a reflex at the foot coming up, and again on the other side. And then just right back here, I would tap, and there would be a flex as well. Okay, so at this point, I still need to take a listen at carotids. So I'm going to listen at your carotid here. And then I'm going to feel over here. Just make sure that they both fill. normal. And then I'm going to do the same thing on the other side. Listen. And then it's important that you don't push on both sides at the same time. So listen on one side, then the other. And then I also just need to palpate and feel that. And then also palpate and feel that one as well. Okay, so now what I'm going to do is just put your feet out. I'm just going to check just to make sure that we don't have any edema. And then one other test I forgot. So while you're lying, but I'm not going to have you lay back down again. So as you were lying, I would flex the foot and then let it go. And then if you felt any pain, you would let me know. And that is a potential sign. Pain with that is a potential sign of a DVT. Now, as you're also sitting there, go ahead and just relax for me. I would flex this up and then let it go. And if there was flapping, then that would be something to be concerned about. Let's see if I've gotten everything that I need to get here. Just wait for a minute. Okay, I think that we have finished our exam. Thank you, Amber.